Hi, I'm Mr. Chandra Cheruvu, consultant upper GI bariatric and laparoscopic surgeon at the University Hospital in Stoke-on-Trent, and I'm proud to be here for the last 22 years. And this hospital has grown massively with excellent progress all around. I completed my surgical training, high surgical training at St. James's Hospital in Leeds, and then did fellowships in cancer in Liverpool and Japan at the National Cancer Center, followed by a fellowship in bariatric surgery in Melbourne. I was appointed to Stoke to develop the cancer surgery, and it's a great opportunity. People ask me, why come to Stoke? I had options to go to 7-8 places. I chose Stoke for one reason, because there's a great opportunity. There's no existing service or a suboptimal service. So it was a great opportunity. The vision was to develop a good cancer center for esophageal cancers, and along with that, the laparoscopic surgery it further evolved into bariatric surgery. I had the opportunity to develop cancer surgery, laparoscopic surgery, and bariatric surgery in this hospital. I'm eternally grateful to the hospital and the patients who gave me the opportunity to do all this. People in Stoke are simple, straightforward, and most of the thinking was local. When I worked in Jimmy's in Leeds, I realized they had an advanced vision. They were working 10 years ahead. Whereas when I came to Stoke was only thinking about that times. There's no forward thinking or vision. And that's what I worked with this chief executive, other members of the team, said, this is what we have to be. We have to be numero uno, number one in the country. We have to build it up. It takes ages, it may take a couple of decades, but that's what we have to go. Or on top, equal to one of the best in the country. Fortunately, I had some good leaders in the hospital who supported me, and in my first year of coming here, the cancer mortality was 15%. We were able to reduce to 2%, which we managed to maintain for a long time. Later, we developed laparoscopic surgery, which is evolving at that stage, and every laparoscopic procedure done in the world, we were able to introduce here. And after that, the bariatric surgery, it was a nightmare to get bariatric surgery going, because people don't believe me that it's a disease process. You know, they could have 20, 40 or 200 health conditions with the weight problems. And it took me 3 years of hard fight, every day battling while doing my regular work, saying this is important, we need it in this hospital. You know, this benefits the patients. One of the chief executives believed in me. However, the internal structure was such that we always short of beds. We had a problem. Develop a new specialty is difficult. Patients went up to one of the MPs. I'm very grateful to her, called Charlotte Atkins I think she's from Biddulph Moorlands. I believe she raised a question in Parliament in 2006, following which we had bariatric surgery up and running in Stoke. It's an amazing story, and I'm grateful to my patients and to people who helped me in this journey. And we are now, I'm proud to say, we've got a team of 6 surgeons. We perform the largest number of obesity operations in the country, bariatric operations, and we have over a couple of thousand who are free of diabetes and several other conditions. And that's phenomenal. Stoke is rated as one of the most obese cities in the country. I think in 2014 or 15 it was number 1 obese city in the country per 100,000 population. And still, it's still rising. As you know, obesity is still rising. And obesity doesn't come alone. It comes with hundreds of health conditions like diabetes, blood pressure, heart failure, joint problems. So my patients, when they come to clinic, they got a list of 20, 30 problems. By doing the operation, we're shifting the extra weight off, and all these majority of the health conditions get better. And that makes people get back to work. So I've got several people, stories where they never worked for 20 years, back to work, and they're very proud saying, I'm paying my taxes now. We have to live for future as well, for future generations. We live for now, but we have to think of future ahead. We need to train our next generation of doctors, surgeons, students, everybody to come up to speed to manage all these services. If we don't train, as a senior surgeon, if I don't train, the next generation suffers. Patients suffer. Training is the key element, and the best part of an NHS, which I love, is the opportunity to train everybody. Everybody comes to NHS. NHS has got two functions: one, patient care, and two, teaching and training. That is the best part. I don't think this model is replicated anywhere in the world. That's why even today I say NHS is the best health providing service in the entire world. I say this with pride because I give lectures in Middle East, America, or India, or Far East. I talk about this. Training future doctors is essential. Otherwise, I have to go abroad to get an operation. I don't do that. Our people are good. It's appropriate opportunities. My idea is to create appropriate opportunities, a ground network for people to train more. And that's why we developed the skills lab here. I had a grant from a company in 2006 for $250,000. We have a laparoscopic stack system. We run national courses here. In addition, during the COVID times, we had our surgical trainees taken into medical wards who are just acting as nurses or attenders. And they were dejected. Naturally, young people want to do more, operate. They like operating, but they're not doing it. So I met a few people in the corridor and they said, Mr. Cheruvu, we're getting really depressed here. I said, don't worry, we'll do something. We'll make use of this situation and do something good. So I brought them together through Zoom meetings. We developed clinical research on COVID. And in the first year, we presented 3 papers. And now, we start with 3 members. Now we are up to 115 members, of which a third are consultant doctors. And we have produced over 60 presentations around the world and over 40 publications in peer-reviewed journals, which is amazing. And some of the trainees have gone to higher positions based on the clinical research, along with their work, of course. Other aspect is, in 2023, based on the work they did, we had one trainee getting an award, national award, win a prize at ASGBI, which is the highest surgical training meeting in the country. Fast forward 2024, we had 5 awards. 5 of our trainees won national awards, right from houseman level to registrar level. So this is gratifying, satisfying. I can't ask for more. So we want to pursue more, do more. I can't put it in words, to be honest, but it's gratifying. It can't be more happier than that. Every night I can go home and sleep happily that we've done something and plan for the next year, what else to be done, how to develop, how to help somebody. The greatest gift, which my daddies tell me, is in giving rather than taking. And I always tell my children that, who are both doctors, it's all fun in giving. Try to be in a position where you have to excel in what you're doing, and then you're a provider, help people, train, teach, community, service. It's a global phenomenon, wholesome. Just being a good surgeon alone is no good. Yeah, okay, it's good practice. But what can you contribute to the society you live in? What can you contribute to the organization you work for? What can you contribute to the junior colleagues, under members who look up to you when they are in trouble or when they want to learn? So that's the motto. On that aspect, locally when I came here, there's an Indian association, I'm from India originally, association, different communities. There are more than 1,000 families in Stoke alone. They want to build a temple for 50 years. They had a dream, but they couldn't do it. So someone approached me about 8 years ago, said, oh, we should do this. You should build. I said, initially I said I didn't have the time, I wouldn't be able to do it. But it's just slow. It took me 4 years to bring everybody together. And I'm proud to say today we built a temple which when it opened 2 months ago, and it's a dream come true. Very satisfying, because an opportunity when people can come together, sit and talk. We invite all religions. I invited the church leaders, the Muslim mosque leaders, the Gurudwara leaders, Jains, Buddhists, Sikhs, everybody to come together, and we can talk together, share our thoughts, beliefs, and help each other, help the community. So the community lives in peace, hand in hand, working together for the benefit of the people.